Imagine waking up every morning, looking in the mirror, and seeing a flaw that is very apparent to you. You obviously see it. It could be your body, it could be your face shape. Something's wider than yesterday, or maybe even from 20 minutes ago. And you go and ask somebody, do I look any different? Do you see what I'm seeing? Only for them to tell you, no, I don't know. I don't see what you're seeing. How could you think that way about yourself? That would mess with your mind, right? Believe it or not, this is a condition called body dysmorphic disorder, or body dysmorphia, or BDD. Throughout my speech today, I will inform everyone about BDD and how it affects one's day-to-day life. Body dysmorphic disorder is a very serious mental health condition, and I believe it should be treated as such. In many cases, this disorder is brushed under the rug and not really talked about often, mostly because people don't really know how to deal with it. Nobody can understand how someone can see something wrong with themselves and it's not there. I believe this should be dealt with. It should be talked about more, and there should be more treatment plans for this disorder than just therapy, talking about it. I have done countless amounts of research for not only this speech, but throughout my life as I have suffered from BDD. In this speech, I will speak on what body dysmorphic disorder is and what body dysmorphic disorder is like when living with it on a day-to-day basis and living with it personally. Let's first discover what this disorder truly is. According to Johns Hopkins Medicine, body dysmorphic disorder can be defined as being hyperfixated on a flaw to the point of disruption in everyday life. Considered to be a related and classified type of obsessive compulsive disorder as well. Mostly because of the shared characteristics. According to Phillips in her book, Psychotherapy and Psychosomatics, this may trigger feelings of depression, anxiety, and stress, but also turn into compulsive behaviors. These behaviors may include picking up the skin, looking at your body excessively, hyperfixating, or avoiding mirrors excessively. This is a very serious mental health condition. Not only is it classified as such, but it also causes many other mental health conditions along the way. Severe anxiety, like I said, is occurred and takes place throughout everyday life while dealing with this disorder. You become anxious to think about how somebody may view you. It may disrupt the way that you go to class, how long it takes you to get ready in the morning. This truly does disrupt your schedule, and it may even lead to suicidal thoughts which stem from depression. Depression will stem from the feeling of not feeling good enough, not feeling worthy, not feeling beautiful or comfortable in your skin. Suicidal thoughts stem from that, and isolation may occur as well while living with this disorder. This is why it should be considered a severe mental health condition. Repetitive behaviors, like I said, may include excessive mirror checking, mirror avoidance, excessively, picking up the skin, and also just constant validation. When individuals pick at their skin repeatedly, it may be a form of self-harm, or it could be to hide a piece of skin around a certain person. It may feel easier to just hide that piece of skin. If somebody's arm fat feels too much for them and they feel like they can just tuck it away, they will, because it makes them feel more comfortable. These individuals will constantly ask for validation and reassurance as well. Not because they want eyes on them or attention, but because they want to appear normal, beautiful, and decent to avoid the anxiety from building or interacting with others. You're more likely to stare at somebody on the street if they look out of place, right? If somebody looks a little different from you, your natural instinct is to divert your eyes or your attention to them. So for somebody with this disorder, it's much easier to blend in, make yourself seem normal, and just appear like anybody else and just fit the standard of beauty. Now that we have gained an understanding of what the disorder truly is, let's now take a look of what it's like to actually live with this disorder. When living with this personally, it truly does affect your day-to-day life. This disorder will pause your day and make it harder for you to get out of bed or get dressed. In an article from Cambridge University by Ross and Goers, they call this disorder a disabling condition. Disabling. Doesn't that word have so much weight to it? We use it to refer to people that have lost their ability to do everyday things. Disabled. It truly does mess with your mind that much to the point where many people that deal with this disorder can't get out of bed and can't push themselves to go throughout the day. It may delay how much time you take to get ready in the morning, and the anxiety of it is paralyzing and depressing for those who struggle with it. If you were to look at yourself, you may become hyperfixated, which just diverts your attention and causes more time to be wasted in front of the mirror. You may also take time to correct this flaw that you see because it bothers you that much. Symptoms and self-destructive behaviors are often associated with this disorder as well. Along with increasing anxiety and depression, many other self-destructive behaviors may occur, including binge eating, purging, and restrictive dieting. Binge eating is when you go a period of time without eating. It could be days, it could be hours, and then all of a sudden, you gorge on food that makes you feel good. That's the only way that you can get rid of it, right? You want a way to feel good? It is proven that there is a chemical in our brain called dopamine. Dopamine is a chemical that our brain attracts and obtains when we eat something that makes us feel good, drink something that makes us feel good, see something that makes us happy, or do something that makes us happy. This chemical releases chemicals into our brain and makes us happy and content with the way that we are. So, when binge eating, you all of a sudden get that rush of dopamine and you automatically feel better. This is often why people binge eat after not eating for days. Binge eating can be described also as eating excessively. Maybe you haven't been starving yourself, but eating excessively can also be considered binge eating. Purging is another part of eating disorders, which includes throwing up meals after you eat them. This is forced through shoving fingers in your mouth or another object such as a toothbrush. Many people do this just so that they can activate their gag reflex and get that food out of their system, which is purging. Restrictive dieting is also extremely tempting within individuals with BDD, especially if one believes they are overweight. This may look like pushing food around a plate instead of eating it, throwing away meals, only letting yourself eat a certain amount of things throughout a day, or only taking a limited amount of bites. Many people will often tell themselves, I can only eat this because I ate this before. That is restrictive dieting. This condition will also have effects on your relationships. Not only romantic relationships, but also relationships with loved ones, family, friends. If you were to ask somebody how they viewed you, and you're telling them about something that you visibly see, and they tell you it's not there, it's obviously going to mess with your mind, right? It's going to make you not trust them as much. This will make you distance yourself from loved ones and individuals because of that lack of trust. It will change your perspective on them, and it is very common to quarrel with loved ones or other individuals with this disorder. You may not trust that person or want to put your feelings out there again because you're so afraid of getting hurt and rejected by the way that you see yourself. Due to a lack of trust, you may also begin to act differently and angry because of the way you feel about yourself. It's really nothing to do with the other people, but yet you can't help but take it out on others. That hatred for yourself often builds up to the point where you won't want to be around anyone or anything you loved, which we discussed prior during isolation. Isolation does nothing but increase your built up and suppressed feelings because of the lack of communication there. If you don't communicate, you don't let anything out, then you're just suppressing your feelings. It's just going to build up, right? Although therapy should be more excessive with this disorder. This disorder deserves more. And to conclude my speech, I would like to state that body dysmorphic disorder is a very serious mental disorder that should be talked about more often. These individuals deserve understanding and compassion rather than someone convincing them everything is all in their head and forcing them to deal with it silently. Thank you.